Yesterday, the Minnesota Department of Health released which long-term care facilities have a confirmed case of COVID-19. Previously, health officials said it would not release that sensitive data, and it could be in violation of state privacy and federal privacy laws if it did. Katie Steiner joins us from our home studio this morning to tell us what the state announced yesterday and how families are coping who have loved ones inside those facilities. Good morning, Katie.
Good morning, Esme. There are about more than 30 facilities in the state of Minnesota that have a confirmed COVID case. Some of them have more than one. And Governor Tim Walz yesterday announced that he is going to be releasing the list of these names. He said that this is unprecedented for the state of Minnesota to be doing. So in order to be released, they are only going to be releasing facilities that have more than 10 people inside those facilities. So right now, 32 places have a case, 7 have 2 cases. Some of those facilities, it's only a staff member. Some of them, that's a staff member and resident. In total, there are about 60 residents in the state of Minnesota that have the virus. 26 staff members at those facilities have the virus. Now, the state has provided the facilities with letters that they can send to families. Shelly Montilibongo got one of those letters earlier this week. Her 96-year-old dad lives at Presbyterian Homes of Bloomington. Someone from her family used to visit every single day. You can see there some of those visits, but obviously they can't do that anymore. She said she completely understands why, but it's still hard, and she thinks it is impacting her dad.
There's some cognitive decline and memory issues and confusion, but I think us being able to physically be there helped to keep him on track a little bit easier.
And a lot of these things have changed inside those facilities because of the virus. You aren't seeing nearly as many programs. A lot of places are cutting those programs. They're eating alone, so there's really no contact. They're trying to keep the residents as isolated as possible, but obviously that's really hard for the people inside and the loved ones as well. As for the facilities themselves, they are able to come off of that list once the Minnesota Department of Health decides that there is no transmission and that they make sure that there's no transmission going on inside of those facilities.
All right, Katie, thank you so much.